presentation is to have an overview of pain management and pain patients, and of course the outline, like you see, we will look at the causes of cancer pain in our patients, and we will look at the magnitude of this pain on the patients and our holistic approach to assessment of pain in a patient, and then finally we will look at our roles in intervention and management of pain in cancer patients. We have heard from one of the key speakers, particularly Sabina, how the role, the evolution of oncology nursing has gone over the years to a point now that research is one of our main focus, so that we will get evidence bases that we will depend on when we nurse our patients. And this brings us to the fact that research is going to play a good role in our focus in management of all patients, particularly oncology patients. Now, if I look into the prevalence of research in this particular category, we will see that in 2000, there are a review which seen that 30% of all newly diagnosed patients with cancer, they do have pains. And 50 to 70% of patients receiving active anti-cancer medication have pains. Also, 60 to 80% of patients with advanced diseases, cancer advanced diseases, do have pain. So if you look at these statistics, then it means pain is a major problem for the patient and for us, the caregivers. Now, if we go specific, pain is becoming very common with patients that have cancer. Very, very common. There is another recent survey done. This is the year 2007. It was found to find that 33% of patients report pain following treatment that is intended to cure cancer. And 59 of them who are receiving anti-cancer drug, whether it is curative or palliative, do report pain. Similarly, 64% of patients with advanced cancer complain of pain, and 53% of all people with cancer at all stages of the disease do complain of pain. So, pain is a major problem, and we must learn how to deal with it because it will live with the patient for some time. Having said so, what is this pain? Now, there are so many studies that try to define pain and give us understanding of what pain is. Pain is what the patient says it is. Pain is a self-reported subjective phenomenon, meaning there may not be biological markers. For instance, like blood pressure, like temperature, it's very easy to have machines and something that will help you to diagnose. But with pain, as of now, the patient is the only person who said what it is. Pain is more like a psychosomatic phenomenon. It is modulated by the mood of the patient, his morale, and he gives meaning to it. So when he said he has a pain, then the pain exists. If we go further to look at evidences of how we can define pain, we will see that Meki and et al. In 1994, they said that pain is an unpleasant sensory and emotional experience. Even though it's mood, but it is not a pleasant experience. It is unpleasant. And the International Association for the Study of Pain, which is the biggest organization that deals with pain, has the definition. They said it is an unpleasant sensory and emotional experience